Okay, so this is the second reflection vlog on the course. This week we'll be focusing on weeks 4 through 8 after the fact. And the same structure as last time. I'll take a few of the readings, videos, and recordings, and other recordings that I thought were major influences and important as to um, why they were important to my views of what was going on within these weeks and just kind of breaking down what I found interesting about those. So we'll first start off with some statistics that came from the Robert Wood Johnson Foundation's report on health equity. Some of the statistics that's really stood out to me, um, and why I think they're important. I'll follow up with that. But the idea that, not the idea, but what the report found was that 20% of healthcare outcomes or health is determined by clinical care, whether that be within the clinic setting or within the hospital setting. But the overarching fact that social and environmental factors account for nearly 50% of the healthcare outcomes um, really kind of set the idea and base and groundwork for what these weeks were really trying to drive home is that environmental and social factors contribute to health more than we actually think of, and kind of deconstructing the idea that it's the individual's issue or fault for their healthcare outcomes, but really refocusing on it on the idea of the environment and social factors are contributing and creating these healthcare outcomes for individuals within these individual communities and neighborhoods. And that really kind of reflects within some of these other, I did three other um, pieces from the videos and from the reports and readings that just really kind of influence and highlights how environment and social factors play a part in individual healthcare outcomes and why this might be. So the first one was the EPA's video on Journey to Justice, which showed communities of color at greater risk for pollution, for air pollution, water pollution, and contribute to chronic diseases like asthma, cardiovascular disease, and things like that. But it really showed these individual neighborhoods and highlighted that these people are products of the environments that they're unfortunately part of. Through policies, systemic racism, things along those lines that we really kind of touched on in weeks 1 through 3 about how health is focused on within race and things like that. But I think we all really kind of remember the Flint, Michigan water crisis, and then we reviewed during these weeks what was going on within Houston, Texas, and a few of the other areas. So really, this just shows that the environment is bad within these communities of color that still exist. So the next one that I wanted to focus on was the discussion or the review on the systemic review of built environments and health. I think this kind of shows the polar opposite of what the EPA's video kind of showed. It showed that rates of obesity, depression, and even alcohol abuse are lower in neighborhoods with walkable neighborhoods, green spaces, and access to healthy grocery stores. So it just shows that, one extreme of the other and the other extreme of the other, and how there's actual findings that show that there's lower preventable healthcare outcomes in these neighborhoods with walking spaces, green spaces, and healthy access to healthy grocery stores. And then the last one was just another one of that was a little bit more sad was the health risk in liquor store study that showed Black neighborhoods have a higher disproportionate number of liquor stores within their communities. So that just shows how environments kind of breed this idea of poor health poorer health outcomes and how it really influences the individual as well. So what I took away from this week and what I want to remember in 5 years kind of go hand in hand with all this is just remembering that it's not an individual's problem. It's more of the environmental and social impact that it has on an individual. So trying to remember that that's really the important things that come from this week is that a lot of people within healthcare think even without even outside of healthcare, I think it's an individual's issue of why they're in the hospital or why they're here for this or why they have that. But really, we need to kind of break it down and look at where they're at, how the environment essentially impacts them. And then in 5 years, just remembering this and how can we improve these areas as well. And I think that's kind of the goal and basis for a lot of public health care outreach and work, and just how we can improve and continue this work as well. So that's what I thought about this week, and my reviews, what I thought stood out for it for myself, and then also just kind of reshaping ideas and ideas and what some of the mindset might be for individuals within these communities. So thank you.